Hello, and welcome to you all. Let's just see if we can get my screen up so that you can see me as I talk.
It's okay, we can see you.
You can, great. Thank you very much. Hello and welcome. I'm Robyn, and I'm a Senior Consulting Fellow with the Global Health Program at Chatham House, and we're delighted to be a partner of the One Health Poultry Hub. This is the fourth panel in the Roadmap series, Discussions for the Future of Poultry, People and Planet, which is kindly funded by the UK Government's Research and Innovation Programme. This series of fortnightly discussions seeks to address key issues underpinning sustainable development from the perspective of nutrition security and the poultry industry to contribute to the United Nations call that we build back better from the COVID-19 pandemic for the future we want. Just as we get underway, let's cover a few housekeeping notes. Today's discussion will last for 1 hour. The event is being recorded and it will be available on the Hub website, and a direct link will be sent to all of you who have registered. Please put your questions to the panel through the Zoom Q&A function, and you'll access that at the bottom of your screens, and do vote for the questions that you like. If English is not your first language, don't worry. I'm Australian and my English colleagues tell me that I also struggle with the language. Of course, if you prefer, you could run your questions through an online translation service, but really don't worry too much, just ask your question. I'll put as many of your questions as possible to our panelists. If your question is covered by a previous answer, or if we run out of time, please accept my apologies. We have an online discussion channel that you can access from the Hub website and from your registration link. Do explore this to share your questions, comments, and thoughts. These online discussions will contribute to a series of briefing notes that will be prepared as an output of this series. Today's discussion is on keeping poultry production safe and healthy. And to get started, we'd welcome your thoughts on this topic via the first poll, which should be coming onto your screen now. The poll will disappear from your screen once you vote. I'm delighted to welcome our expert panelists for today. We have Dr. Claire Heffernan, who is the Director of the London International Development Centre and the Director of the UKRI Stunting Hub, and Dr. Theo Kanellos, the Director of Commercial and Strategic Alliances at Zoetis. Once again, welcome to you both. You're each going to have 10 minutes to present your thoughts, and we'll give you a signal at 9 minutes letting you know that you will need to wrap up. Oops. Just trying to vote so I can see what's happening there, and I don't have that option. Okay. So without any further ado, do please vote, and now it's over to Claire. Thank you.
Yeah, thank you so much. And thank you so much to the Poultry Hub for inviting me to do this. It's such a pleasure. Let me see if I can share my screen. Great. So I thought I'd use my time today to try to untangle this interrelationship between human and animal health, food safety and food security using poultry as a lens. And I wanted to focus on 3 problems where poultry has a role. So first, I'd like to talk about malnutrition and the role of poultry production in ending child malnutrition. And then I wanted to touch on the health impacts, or EED, environmental enteric dysfunction in children, and poultry keeping has been implicated in this. And then finally, I wanted to explore a little bit some of the wider environmental issues, and specifically AMR in poultry production. But I thought it would be really useful to frame my remarks in a very old concept that's currently having resurgence in the literature, and that's this notion of tame versus wicked problems. And so what is a tame problem? Tame problems are essentially problems where we know science can solve it. We can define the parameters, we have the resources and technical knowledge to effect a solution. Wicked problems, on the other hand, are so unstructured, so complex, we can't adequately define the edges. And the original argument was that science was set up to deal with tame problems, but it wasn't to deal with wicked problems. So in terms of malnutrition, of course, we can't talk about malnutrition without acknowledging the pandemic. And we know that COVID-19 has been swelling the number of households under food stress. I think the World Food Program has quite a frightening statistic that the number of people in LMICs facing acute food insecurity will be around 265 million by the end of this year. Now, a recent estimate published by Lancet noted there was about 6 to 7 million more wasted children, and these are children who weigh less than they should for their height. We don't know the impact on child stunting. Now, stunted children suffer from impaired linear growth, they have cognitive deficits, and they also suffer from intestinal disease. Now, I thought I'd show an example, and India is a very good example of this dichotomy between malnutrition and poultry production. So I think more than a third of the 142 million children globally who suffer from stunting live in India. But in 2019, India produced 19 billion eggs, and this was according to the Indian Council on Agricultural Research. And so it strikes me that 44 million children, stunted children, 25 million wasted children, 6 million COVID vulnerable children, 76 nutritionally vulnerable children million versus 19 billion eggs. Eggs are a very low cost source of protein, 1 to 2 to 3 rupees per egg. So why isn't this the solution? Why isn't matching nutritionally vulnerable children to eggs, what we should be going for? And I think there's a lot of reasons that this hasn't happened, and it's really around equity and access. Many of these eggs are bound for external markets. Palatability, children don't traditionally eat eggs, and many states have had programs to try to support egg consumption among nutritionally vulnerable households with kind of mixed success. But I think what's really interesting about this chicken and egg story in India and in other countries is a lack of, I would argue, deep evidence. When you start looking around, there's very, very few studies, high quality studies that have looked at the impact of egg consumption in preventing or ameliorating the specific clinical features of malnutrition, such as stunting. And we know that eggs can have an impact on choline, which is an impact on epigenetic signatures. So the question becomes, can egg consumption during pregnancy help to prevent stunting? So eggs, but this is the other thing, eggs aren't entirely benign. We know there's a range of foodborne risks from salmonella to campylobacter, and Theo is going to talk more about this. But we also know that malnourished children often suffer from intestinal enteropathies. And there's an emerging body of literature here that really demonstrates children living in households may be more at risk. And I would encourage you all to read Robyn's excellent paper on this. But there's, if we look at the body of literature as a whole, there's been very, very few studies that have linked confirmed cases of EED to the specific pathogens in poultry. So the evidence demonstrating, direct causality is quite low. So here we've got egg consumption as part of the solution, but poultry keeping may also be a driver to EED, which is a key clinical manifestation of child stunting and child malnutrition. But this also brings us to this really wider environmental issue, the impact of poultry production on the environment. And here I'm going to focus on antimicrobial resistance. We know that environmental AMR is increasingly recognized as a major problem, and antibiotic pollution is found in our water supplies. And interestingly, this antibiotic pollution is classified as a class of pollutants referred to as contaminants of emerging concerns, which means they're unable to be removed by current wastewater treatment technology. And I think it's here that poultry production systems and their use of antibiotics, we need to dive down into this and look at this better. And so how do antibiotics get here? into our water sources? Well, it's quite simple. It's largely through the poultry litter. And poultry litter, many of you know this, I'm sorry to have to say, but it's usually sawdust or straw. For every 1,000 birds, you need about 82 cubic feet of litter. So what's in this litter? Well, it turns out there's quite a lot. So there's metals, there's arsenic, there's copper, there's iron, selenium, there's zinc, and these are often added to poultry feed to improve weight gain. And we know heavy metals are a big problem in AMR. There's a variety of studies that shown that the level of metals in poultry feed are concentrated at least 2 to 3 times in the litter. And so after the runoff, after, when this is used as fertilizer, this runoff contains high levels of bacteria, the metals, and the antibiotic residues. And it's really a global problem. I think 90% of the poultry litter, I'm going to use a US one, is used as fertilizer and spread on farmland. And this is kind of an interesting example. The Delmarva Peninsula is home to 523 million chickens. It's part of the poultry belt in the US. And they produce an estimated 42 million cubic feet of litter. And most of this goes around on the surrounding farmland. The Chesapeake Bay is considered one of the most polluted waterways in the US. So how do these issues play out in the global south? We're currently involved in a project which explores antibiotic pollution in the Nairobi River. And the Nairobi River has a kind of, unhappy association with it's the 4th most polluted water river in the world. And I think there was a recent study that found there was over 24 antibiotics. And most of the informal settlements are located on tributaries of the Nairobi River. And there's a large number of people in poultry that live in these environments. But equally, another issue in Nairobi is the number of poultry slaughterhouses. And so, some of the bigger operations actually do have water treatment plants on site, but everybody else really doesn't. So there's a large amount of effluent and waste water from these slaughterhouses that go in local water supplies. So where do all these examples leave us? I think that we've been approaching all of these complex problems from different but equally very unhelpful perspectives. We've spent absolutely decades looking for the silver bullet to solve child stunting, and with very, very little success. And with this lack of success, it means that too often we see child malnutrition as a wicked problem. And I think this is really unhelpful. Child malnutrition at its core is a Tame problem. How can we deliver safe and nutritious food to vulnerable children? And then how do we get them to consume it? So I think it really is a question of matching 19 billion eggs to 76 million children. And I think the poultry sector can play a very big role here as part of the solution. But equally, preventing environmental enteropathies. Again, here, I think this is another Tame problem. And this doesn't dispute the scale of the problem, but we can support awareness raising and behavioral change among small scale producers. This isn't an impossible ask. Now, the last one here, AMR, I think we have a different dynamic. I think here we approach AMR in LMIC countries as if it were a Tame problem. And, when you read the AMR National Action Plans, they tend to really focus on overuse, and their solution space is really about building sufficient capacity so we can control it. And I think, as soon as you start unpacking environmental AMR, you realize that this isn't going to work. So I think here we need technological solutions to start to enable us to kind of leapfrog what are our weak regulatory environments. So I guess I'm going to wrap up, and I just wanted to share a few key messages. I think in order to build back better, the evidence base needs to show how the benefits of poultry production can be amplified and the risks ameliorated. And I know that this is a core aim of the Poultry Hub. And the other thing is, of course, enteropathies can be prevented, but we need better research to develop tools and approaches to work with small scale producers. I think regarding environmental AMR and contaminants of emerging concern, we need a much, much better joined up response to this globally, nationally. The poultry industry is a very large player here, and they need to be part of the solution. And I guess finally, I'd like to say that, we know problems can cascade through systems, and they tend to amplify as they do in intensity and complexity. But I would argue that solutions can also cascade through systems, and they really enhance our ability to unpack these issues. So in short, I think we need wicked solutions to these wicked problems. So thank you very much. I hope that I was on time there.
That was great, Claire. Thanks so much. We've already had one question come in for you. And as you stop sharing your screen, I'm wondering if our wonderful tech people could show us the results of that first poll. That is a very encouraging result. Thanks so much. And thanks to those of you who voted. So Claire, we've had a question come in from Naomi Marks, and she's asking, in your opinion, how can we ensure that poultry production plays a greater role in the solution to child malnutrition?
Okay, thank you, Naomi. That's a great question. I think, when you start digging into literature, you realize how siloed it is. And it really is siloed. The vets talk about poultry and health in one way. The medics tend to focus on a completely different area. The WASH behavioral scientists, they tend to look at things in a different way. And what we need is essentially what you're offering is we need a One Health approach. We need an umbrella that allows us to talk to one another and put together the full picture. So yeah, I think that in this particular case, I think One Health can really, really help support us here.
Thanks so much, Claire. That's a wonderful answer and a great presentation, which is now going to lead into our second presentation by Theo. So over to you, Theo. Thanks very much.
Thank you very much, Robyn, and delighted as Claire as well and myself to be in this panel and discussing this important subject about poultry production and try to understand better how we can help. Of course, I will try to bring from my side the industry perspective and try to explain how we could potentially develop tools and ways to keep the poultry safe. Of course, from our side, as Zoetis, we've been in the industry for over 65 years, and we've seen the growth of the different industries, either this is ruminants or either this is poultry, and we continue bringing, we think that, with our researchers, we continue bringing, innovation, because we believe that this is the solution to all these significant health problems. So I thought today to just give you a few slides, so to present, the overall industry and a few areas which I hope will stimulate discussions later on. So let me start with saying, where is poultry industry, poultry health industry belong within the whole animal health industry? So the animal health industry. It's a large industry. It's around 40 billion industry, and the poultry part is a significant part in this industry, around 10 to 15%. So we're around 5.7 to 6 billion per year. And this animal health industry is very much driven from medicines, vaccines, parasiticides, medicated feed additives, which are all play a significant role in keeping the poultry safe. And my discussions and my presentation here will very much focus on the farm level. So these are the tools that we have today, either in developed or developing countries, to be able to combat diseases. And then what we see in the last few years, you see some new technologies or some new areas to take more, to become more important. So we see more diagnostic, we see more bio devices, we see more genetics, and also what we call precision livestock farming with data and digital tools to try to help expand and put the different traditional products that we have towards keeping poultry safe and healthy. One area that I wanted to touch here is about the growth drivers, and just to all our partners and all the participants here to understand that poultry and animal health is a growing area. It's an industry that keeps growing, and this makes sense because there are some key drivers. The first driver is the growing of global population. We know that from 7 billion it will become 9 billion. That's the predictions, but we know as well that there's going to be a rising middle class. What that means is that we know that the middle class will prefer to have or to have more animal proteins, but also they will want to have proteins that is healthier, and as such, we know that healthier animals will be needed. We know that there's going to be a growing protein consumption at different levels, and of course, we will know that these animals, the society will want to be kept in very good conditions, and the welfare will be of paramount importance. So increasing demand for animal care across the species is important, and a lot of our professionals in poultry hub will need to continue towards that. If we go to the next slide. So within Zoetis and within the industry, my first message is that if you have healthy animals, we will have healthy people. That's the typical One Health approach. So to keep healthy animals, we believe within Zoetis that we have to bring all the necessary tools to do that. So we have moved to what to call a solution approach on the continuum of care. So we do believe that unless you bring all these tools to the farmers, to the vets, it's going to be not so easy their job to keep their poultry healthy. So in this particular case, we know that genetics are critical. So we work quite closely with most of the genetic companies in poultry because they will bring chicken that they will be more resistant to disease, more adaptable to the environment. So genetics plays a significant role, and it's important to be considered as part of the tools that we have. Then you go to vaccinations and prophylactics, and to try to prevent disease. Always we believe prevention is better than treatment. And again, from the vaccine perspective, we have a number of vaccines for most of the diseases that are available and all they're possible. But again, some of these vaccination strategies have to be driven very much from the actual country. And also, we believe that that the vaccinations has to be given as early as possible, and you have invested in novel vaccination as early as into the egg, and that's pretty unique on how we can do vaccinations in poultry. Automation, again, in some of the developed countries as well, are critical because of the number of chickens. Then continue on on our tools. We believe that data analytics and sensors will start playing most important role, even in the more smaller farms. So, and sensors will start giving us more information on a 24/7 approach of what is happening, what is the humidity, what may be changing within the flocks. And then diagnostics is an area that we feel that's growing a lot, because unless we have more diagnostics to understand what type of strains are in the farm, is it salmonella, is it campylobacter, what type of prevention measures do we need to have, it's difficult then to bring the right tools. So diagnostics are key to be able to keep the animals healthy. And of course, animals would get disease, and poultry will have the disease, and then you have to utilize medicines that will keep them alive. So, if we can go to the next slide. I think here we talk about the continuum of care, but at the end of the day, especially in a lot of these developing countries, it's important to keep the balance right. So we know that this is a key part. So the social, economic, environmental pressures that poultry producers and poultry operations are facing need to be balanced with all this with the productivity that they need to achieve. And we firmly believe, and we've seen this for many years, either when I was in academia or now in industry, that innovation is the way forward. So innovative solutions is where we have to go. So from our side, we see that the poultry producers have a lot of pressure to reduce use of antibiotics, increased focus on animal welfare, constraints labor, especially in some of the developed countries. So these are typical social constraints that there are, but there are solutions. There are alternatives to antibiotics, prophylaxis, vaccinations that they can reduce the use of antibiotics, or they can increase the animal welfare. Then when you go to economics, you see that low farmer increase is a highly commoditized industry. The productivity and the health. Also the premiums that can be captured for differentiated product practices, and to see the organic food or other ways that can give traceability into the food chain, and the consumer at the end will be happy to pay this to pay for this. And then again, this is a new trend. And then from the environment perspective, although we don't have the issues that you have with the gas emissions that you have with ruminants or other animals, we still see, as Claire mentioned as well, the issues with the contamination of water and air, the use of manure and so on. So if you can move to the next slide, please. So my next point is about data. So we do believe that we do have tools, but you have to be precise on how we use this tool. And something that all my colleagues telling me from poultry is that the poultry industry is rich in data. So probably it's one of the few industries that has so much data. So the availability of data, either from more rural or more developed countries, it's quite a lot. The question is, how do you transfer this data to something that is insightful and makes sense to the farmers? And here is some of the work that you're doing with University of Surrey and Beehive, where we try to take data from different areas and then try to bring it to something meaningful through applications, through apps that will help bring meaningful results. If we go to the next slide. And the insightful information has to be actionable, and that's what we try to do, and actionable to all the actors in the poultry. Either this is in developing or developed countries, and that's an example of what have we done. For example, here is about the IBV, the coronavirus, and where, by the way, you have a very good vaccine. So like COVID-19, coronavirus and poultry has have tremendous experience of that. So we can see a lot of these vaccinations being very successful in creating billions of coronavirus vaccines every year. So anyway, so here you can see, how we can start understanding, what is the presence of coronavirus in different countries, what type of strains there are, how much usage of antibiotics there are, where the strains they come, and then you can see, how pandemics or epidemics can move. So these are typical services or products that can help farmers and also veterinarians. So if you can go to the next slide, and hopefully this is my last slide. I wanted to say that at the end of the day, to be successful, we need to make sure that we work together with other organizations. And what we found is that the poultry, but in other areas as well, that the public-private partnerships work really well. Here is an example of the work that we are doing. For example, we have a twinning of two universities, one in Africa, the Jimmy University, and the veterinary university in Vienna, where we call it Poultry Aid, and our aim is to develop capacities in Africa, so to help training and help people progress diagnostics and vaccinations in that area. So the critical part here is that we have to work all together towards the same goal, but at the same time we have to be we have to know that the specific measures has to fit to the specific countries and the needs of the local environment. So with this, I hope that I'm on time, and I'll turn to Robyn.
Thanks so much, Theo. That was an excellent overview of the current strategy that Zoetis is using to tackle these wicked problems, to use Claire's expression. We've got lots of questions coming in, which is fabulous. I'm going to go to one that's come in for you, Theo. It's from Catriona Fenton, and she's asking, could you please elaborate on the economic value of reducing the likelihood of antimicrobial risks in poultry on pathogens such as E. coli that are not foodborne pathogens? Thank you.
Yeah, that's a very good question, because we've done quite a lot of work in different parts of the world. So we're part of a major European consortium was called ProHealth, where we found, for example, that E. coli is one of the major, or probably the most important disease in poultry, which utilize, for use of antibiotics. So we know that this is a major pathogen, but at the same time, we have developed, or there is a vaccine, which is quite, which is a recombinant vaccine, and which can be used to reduce the incidence of the disease. I think, we did also, I think, utilizing this type of vaccination approach to prevent the disease, it's critical, because by minimizing the presence of the disease in poultry, then you minimize the possibility of using antibiotics. And very recently, we did also a very nice economic analysis in Australia, in one of the biggest One Health consortium outbreak is called, and we found that the economics of vaccinating as opposed to utilizing antibiotics are positive, and not only that, but reduce also the likelihood of possibly passing resistant strains for urinary tract infections in humans. So I think the evidence is there. I think the important part is to start utilizing this superb innovation that has been developed through vaccines in a more systematic way.
Thanks, Theo. Now, as I say, fabulous questions coming in. I've seen two here, one from Nitish Devnath and another one from Antonio Rota. I'm going to put both of these questions, and Theo and Claire, you can decide whether one or both of you would like to answer. Nitish question is, poultry being the shortest and cheapest livestock, why is this type of livestock not being promoted like other important food crops? What are the major challenges? Claire, can I put that to you?
Yeah, I mean, I think that is a really good point. And that's kind of what I was talking about. It's like, why aren't we viewing poultry as a really big solution, certainly to child malnutrition? And how do we make that happen? And I have to think, we have to think about this a bit differently. We often think that problems are wicked, and I think that we have to stop that because it doesn't help us moving forward. The poultry sector, there's a huge body of evidence that displays that children have, there are nutritional benefits from children living in households that keep poultry. Now, my argument is we don't take it that step further. We don't know exactly the evidence of what happens to stunted children. Can we prevent stunted, child stunting through using these eggs? But, I think we need deeper research. I think it needs to be around, I would argue, one-child research, but we have to engage these partners and stakeholders in the solution space and in thinking about this problem in a new way. So thank you for raising that.
Theo, did you want to add on to that answer by Claire?
No, I very much agree with Claire. I think, it's important to maybe build on some of the initiatives, like some initiatives in Bangladesh and some initiatives in Ethiopia that I've seen that they try to promote the poultry as a source of protein, and which they have been quite successful from what I've seen, and historically, I think poultry helped developed countries to overcome some of the protein issues, protein consumption issues. So I think there is a good possibility there to do so. I think that there are some issues about, you know, how to start developing from the backyard farming into making it a more industrial type of farming. And I think that's again, that's an area that maybe you have to look into.
Thanks. And really, this discussion takes us onto the question coming from Antonio Rota, who says that he believes there is a need to differentiate among poultry production systems when we measure the impact on children's health. Should we assume that family poultry production and intensive poultry production systems have the same impact on health, antimicrobial resistance, and the environment? Big question. Who wants to answer it first?
Maybe I can have a go. Go ahead, Claire.
No, go ahead. Go ahead.
Yeah, I mean, you know, this is an interesting question. I don't know if there are any studies that they can show the difference. I'm not aware of any. Maybe Claire, you're more aware of any studies that, you know, that they will based on real data, because my view is going to be very much you know, from personal experiences that and from my work in Africa and a little bit in Asia as well. So I believe that, you know, the different type of production system can bring different type of diseases. Okay, so AMR may be more important for intensive, but foodborne pathogens are more important for extensive type of production. So I would assume that going more into intensive type of farming will reduce quite a lot of these foodborne pathogens and will bring more quality in my mind. And that's what we've seen in developed countries. But I don't know, Claire, if you know of any studies or on data that can be more subjective, if you want.
Yeah, I think, Antonio, thank you so much for that question. I think it is you know, and that's sort of why I framed my presentation in this way, looking at sort of smallholder production and some of the issues, some of the health issues, and then these wider kind of intensive production systems and these wider kind of issues around AMR. And I think that it's important to realize that in some respects, a malnourished child in a household in a backyard system that likelihood is much higher that they will have animal source food protein if their house, you know, raises eggs. It's not always the case. We're seeing a lot of cases in our work in Indonesia where children are not, you know, there's animals on the, you know, where they live, but children aren't accessing this important food source. So I think access is a huge thing. Market access, these, you know, intensive commercial systems have access to markets, distribution to markets. That's another part of the thing that we're looking at is, you know, how do you deliver safe, nutritious food? Well, and what's in these markets? No matter how poor you are, there's studies that show that like 50% of your diet will come from a local market. So we have to ensure that markets have access to safe and nutritious food. So it's really complicated, but I think, you know, you've really kind of hit the nail on the head. There's two different things going on with very different constructs and complications and complexities, but we have to, you know, we have to link them up somehow. And it's the linking up that will solve, certainly from my opinion, in my opinion, child malnutrition.
And there's a question coming in from Ben David, who asks what sort of egg production in terms of number of eggs is required to try and control or significantly impact on child malnutrition that you've identified, and how far away are we from this target? And as you answer this question, I'm also seeing concern from a number of participants that we seem to be focusing on chickens only. And one of our participants has reminded us that particularly in Asia, ducks are very important. So if every now and then you could also include some data on ducks, that would be great. So over to you, Claire, about numbers of eggs and how we're tracking.
Yeah, one of the things, we've got 2 intervention studies in our hub, and one is in Indonesia, and it's giving eggs to pregnant women in their second and third trimester. and seeing how that plays out on child stunting over, we have an observational cohort over 2 years of the child's life. The other intervention study we have is in India, and that's working with children. And in India, we're creating egg powder, and we're testing recipes for egg powder because palatability is a big issue. Mothers don't necessarily feed their children eggs. Some states, there's, some among certain groups, there's real prohibitions about pregnant women in particular eating eggs. I mean, it's, so there's this real social milieu that we need to kind of dive into and understand better in terms of egg consumption. But yeah, that's one of the things that we're looking at. What's the frequency of consumption, and so what we're looking at is once, these children eat these eggs, what happens to their epigenetics? What happens to their gut microbiome? What happens to their learning and development? So we're using a whole child approach, and we hope to have some answers, more clear answers on that soon.
Thanks very much. The last question has just come in from Ali who's actually coming all the way from Papua New Guinea and has made a wonderful request. Ali is asking, is there a definition of stunting in simple English? As project officers working in developing country and English is our second or third language, how can we get a defined message to mothers and families to understand stunting and for them to address it? That's probably one for you, Claire.
Yeah, thank you for that. And that's another thing that we're working on. We think that the current definition of stunting is really inadequate because it really focuses on impaired linear growth. It focuses on children that are too short for their age. And we think that there's a functional definition of stunting. We think that there's many other elements of this, from the cognitive impairment to gut health. And I think that, yeah, parents often, certainly the parents that we've interviewed won't often necessarily see that there's other things going on in children that are stunted. So I think it's a really, really important point, and thank you for raising that. And that is something that we're working with our public engagement teams, is we need a better message to parents, and we need a message that they understand and that they can act upon. And one of the elements that we're working on is a citizen science approach, where we're developing an app to let mothers measure their children. And then, so mothers are engaged in this kind of measurement. And I think that, we have to, bringing it back to poultry, I think, this is the thing that we need to think about. Is there a solution to stunting, and can we offer it through poultry? So yeah, but we do need clearer, simple definitions to use in the field.
Thanks, Claire. It is a very touchy issue and can be seen as very offensive by parents who are doing the best they can to care for their children. And we from the outside tell them that their child is not doing well. We have a really important question here from Andrew Bison from USAID. And I think this is one to both Theo. I'll ask you to answer first, and Claire, for you to respond as well as you like. But he raises the important need to amplify the benefits of poultry and to reduce the negatives. He cautions around the negatives, which is making donors wary. How can we make a better investment case? And how can the future costs of negative externalities, such as health, environment, be channeled now into improved technical advisory services? Theo?
Yeah, that's a very good question, and I think we face similar things in developed countries in the past. For example, with salmonella and food safety and negative aspects about poultry. I think there are two parts here. One is that people that they work in this area, they just have to take seriously the issues and try to find innovative solutions. So, for example, what we did in developed countries, we just moved into vaccination against salmonella. And now people feel very safe, in utilizing poultry products. So that's pretty successful. But at the same time, we have to move more into positive messages, and we need to increase the communication on what are the benefits of eggs, of chickens, and so on, and how safe they are. We have to, each country will have to make sure that minimize some of the use of some of the processes like wet markets and so on that can potentially reduce the trust to these products, but at the same time increase more their reliance to cold chains and make sure that there is good food safety in those countries. So I think, in my mind, there are two things. One is we need to utilize whatever innovation exists to ensure that the poultry product is safe. And the second part is to continue with the communication to the different communities, especially in developing countries, on the importance of poultry and eggs in their and the benefits they can give to the society.
Thanks, Theo. Claire, what's your thought to that question?
Yeah, I think it's a really good one. I think we need to, in some respects, embrace the challenges and deal with them. Because oftentimes there's a lot of rhetoric about benefits. And then as soon as something negative comes off, the stakeholders, the funders, the donors, they don't want to engage with that. And I think the solution for the poultry sector really is to engage with these things now. We have to deal with environmental AMR. We have to deal with that massive, massive problem, and it will just increase. So, and I think there needs to be really global work on that. And it's like Theo says, people have to feel safe when they're eating a product. And again, that needs to drill down to LMIC countries. So I think that engagement and benefits are really important, but equally, I think the poultry sector and all the different stakeholders need to show that they're addressing some of these really, really crucial problems and that they're ahead of the curve instead of responding to public demand. They're seeing a problem and dealing with it. And I think that would really help engage this wider community in allowing poultry to solve some of these problems.
Thanks, Claire. And that leads into
Claire,
a question that's come in from, oh, sorry, Theo, did you want to keep going?
Yeah, I just wanted to say, listening to what Claire said, Robyn, I think, just have to give a big kudos to you guys in Poultry Hub, because exactly that's what you're doing. You're just bringing all the experts and people from different parts of the world to discuss this. So, from my side, I think this is a unique initiative, and it just shows exactly what they're asking. How do you bring all these subjects and how do you discuss it with experts, but also with other people? And the other clever thing that's happening here is that you have the One Health approach, Robyn, and that's again very important because you go back to what means for the health of people. So congratulations to these organizers.
Yeah,
so well done to the whole Hub team on that one. That's great. And it leads into to one question that's come in from Andrea Britton, who's working on a Fleming Fund project, also in Papua New Guinea, with a strong emphasis on antimicrobial resistance in poultry. And her question is, how can we create an enabling environment while addressing the trends of increased antimicrobial resistance in intensive poultry industries in low and middle income countries? Claire, Theo, who would like to tackle this one?
I mean, I think that's a big role of the Fleming Fund, has been trying to increase capacity around this and the national action plans. And, I think it's not a problem that's going to be solved, quickly. But I do think that, stakeholder engagement is a huge issue, and apportioning responsibility. When there's huge, we need, and the other thing that I actually think what's going to happen is it's about technologies. The AMR space will be about technologies leapfrogging over our political indecisiveness or inability to act or inability to enforce regulatory frameworks. So for example, one of the things is these really water filters that can start sensing when specific antibiotic pollution is in the water. So you can start to trace the antibiotics back to the factory where they were emitted from. So there's technologies and tools that we can to stop offenders of environmental AMR. And I think the solution space here is going to be technology.
Maybe, Claire, if I can follow with what you're saying, and I totally agree with you. I think we need to bring all different actors together, especially in developing countries. And this is some of the work that we are doing with Alpha, together with Bill Gates Foundation in some of these countries, where we try to bring, together Bill Gates Foundation and of course Zoetis colleagues, develop the capacities so to be able to tackle some of these issues. And you have to work closely with the government, and you saw the work that we are doing with in Ethiopia. So I think what Claire said is absolutely right. We have the tools, and we as industry want to rationalize the use of antibiotics, because we have developed a lot of tools like prophylactic tools, vaccinations, diagnostics, and we're moving very much to what we call precision livestock farming. That's what Claire was explaining. How can you understand what's happening and what products are used? But the governments or the actual countries have to embrace that and utilize protocols that and products that they are registered and they have good quality, but also they're using the advice of professionals, veterinarians, that will help them move to a more sustainable type of production, as opposed to just react on diseases. So I think we have the tools. From our side, we keep developing new tools. So we need to work with all the actors to make sure that we'll bring will reduce the uses of unnecessary antibiotics.
We've had lots of excellent questions come in. I think we're only going to have time for one more. Those of you who are interested in animal welfare, please join us in 2 weeks' time. That's going to be a strong focus of that session. For other questions that we haven't got to, we'll take your questions across to our Slack platform. But to finish up, our last question comes from Sarah, and she's asking that, well, she says that she understands the need for a One Health approach, and food security programs often have many components with multiple audiences and activities. But what are your thoughts on a project that largely focused on poultry production, disease control, and behavior change for egg consumption? Claire?
Okay, yeah, sounds good to me. I think it sounds great. I think and now add a One Health approach to that, and you've got a winner. I really think that it's a very good way to go. I think interdisciplinarity unpacks complexity, and I think this is another thing that we need to focus on and support, interdisciplinary research. But yeah, it sounds like a good project to me.
Theo?
I agree. The disciplinary research is important, and also I will add multi-sectorial approach. So I think what we've learned from the COVID-19 situation is that the public, social, private partnership worked extremely well in developing this type of One Health approaches. So we saw the development, for example, of a coronavirus vaccine for humans within less than a year, which is a phenomenon. And we see similar issues, for example, for poultry, and what I think she's proposing absolutely right and spot on, because we see now a lot of issues with, for example, the high pathogenic avian influenza. We see quite a lot of these other aspects that they can really destroy the industry. So we need to have a One Health approach, multidisciplinary and multi-sectoral, to make sure that we protect this industry that is trying to grow in some of these developing countries.
Thanks so much. It's been a fabulous discussion. We could keep going for the rest of the day, but I know you all have other plans, so we're going to have to wrap up. I'd like to ask you to join with me in thanking our two wonderful panelists who have highlighted several crucial points for us to consider. Some of these key points, and our folk in the background are just about to show us the key takeaway messages that you'd like us to take with us. The first point we hope is self-evident, and that is that healthy chickens equals healthy food. And for those of you in Asia, that could be healthy ducks as well, or healthy guinea fowls, or healthy quail. Healthy poultry equals healthy food. The importance of rationalizing the use of antibiotics in farms by the implementation of appropriate prophylaxis and improving farm and value chain biosecurity. These are key to reducing the antimicrobial risks. The third message for us is that it's essential to transform the rich data from the poultry industry into actionable insights by cooperating with the different players and companies across agricultural and food chains. Fourthly, we need new tools to better understand and unpack complexity. Poultry production can play a key role in ameliorating the risk of child stunting, but we need to build a deeper and more joined up evidence base. And we've got some people on the call today that are going to absolutely help us to do that. Fifthly, the role of poultry keeping in environmental enteric dysfunction in children is disputed and will likely depend on behaviours at the household level. And sixth, and finally, the impact of environmental antimicrobial resistance and the role of the poultry sector in low and middle income countries is largely unknown. In environments with often weak regulatory frameworks, technological solutions may be the best way forward. So these are really some key points that we are going to take away and digest. And for you in our audience, what will you take away from this discussion? We're going to open our second poll now, and we look forward to having your response tabulated before we wrap up today. Thanks again to our panelists, Claire and Theo, to our tech team working in the background to make sure everything runs smoothly, and to you, our audience, for your interest and for your questions. Do please continue these discussions on our Slack channel using the link you received at registration or accessed via our website. Apologies for any mistakes, they're all mine. Our next event in this series will be on the 9th of December at the same time. Please do join us to listen to Professor Apollinaire Jenke, the Director of the Centre for Tropical Livestock Genetics and Health at the University of Edinburgh, and Professor Christine Nichols, the Professor of Animal Welfare at the Royal Veterinary College, who will be discussing poultry production, keeping the customer satisfied. And as we say goodbye, here are the second poll results. So thank you very much, and do please stay safe. Thanks very much.